Welcome to the world of Ask Akinola-Anjou. Today's topic, we shall be talking more on the commonest sickness, the commonest disease that affects over 1 billion people all over the world. You can say it is more or less everybody having a situation of hypertension. The definition of hypertension, I shall come into it, but the best way to prevent ourselves from being hypertensive is to learn one of these tricks of knowing your blood pressure, doing your blood pressure measurement yourself. And the machine in front of me is one of the machines used in doing it yourself, checking your blood pressure except when you just switch the blood pressure machine on, like this. Now the machine has been on and it has now done the test, the measurement of the the blood pressure. The blood pressure reading now is 131/88. 131/88. The 131 stands for the systolic pressure when the heart really pumps, and the diastolic when it dilates is 88 millimeter mercury. So this measurement shows that it is below the 140/90, which means the two pressure, both systolic and diastolic, are normal. But the concern now is about the pulse rate. The pulse rate is supposed to be minimum of 60, but nature, there are people probably who are very athletic, they have lower than 60 pulse rate. So, but when the pulse rate is very low, it could also cause what is called classified as bradycardia. Hypertension cholesterol relationship. That is the study we shall do right now. How to prevent hypertension and high cholesterol. Hypertension, according to WHO, is defined as systolic blood pressure of 144 millimeter of mercury or greater, and or diastolic blood pressure of 90 millimeter of mercury or greater to, based on the average of 2 or more seated BP readings on each of 2 or more visits. And we must understand that over 1 billion people are affected worldwide. So hypertension is more or less the number one disease that we are supposed to be all concerned about, and that's the major concern of WHO as regards trying to manage hypertension. High cholesterol is highly related to hypertension because cholesterol generally blocks the vessels. It blocks the blood vessels, and when you block the blood vessels, you narrow it, then you have experiences of atherosclerosis. These, when it breaks down, it could even cause stroke or heart problems, especially if it is a blockage around the coronary artery, that is the blood vessel supplying the heart itself, that makes the heart able to pump. And once there is no blood supply, no oxygen, you can understand that there will be heart attack or stroke. So the high cholesterol predisposes one to hypertension because it blocks and makes it difficult for the heart to beat with ease. The heart has to now enlarge in order to produce to move the blood to all the cells of the body. So that increase in the tension is what really causes higher blood pressure. So the relationship between high cholesterol and hypertension is known and has been a serious study for a very long time. So high cholesterol is also called hyperlipidemia when the total cholesterol is above 240 milligram per deciliter. High blood pressure, that is hypertension, affects 58% of senior citizens, and high cholesterol affects 47% of seniors. So you can see that there is a kind of relationship, almost parallel, that is, there is like a tie when you talk of people who are having hypertension as senior citizens. Then the cholesterol level too, you find up to 47% of them, which means there is a close relationship between the cholesterol and high blood pressure, hypertension. Now let us look at the category. When you talk of normal blood pressure, you are looking in the region of when the systolic is 120/80. Interpretation of the blood pressure, like I earlier said, you find the normal as less than 120/80. Elevated is 129, from 120 to 129 over less than 82. Then the stage 1 is when you have anything from 130 to 139 over 80 to 89. But where you have that serious concern, generally accepted, is the 140/90. Then if that is what is gotten every time you go for this check, then you are hypertensive. You need to now take your medication, see a medical expert on it. The blood pulse rate, like I said too, once your beat is below 60, you are described as having a situation of bradycardia. The blood supply may not be enough. That is, all the cells may not be getting enough oxygen and the nutrients, because it's so slow, and the heart, there may be arrhythmia, the palpitation and irregular heartbeats may be experienced by such a patient. Tachycardia is also when the beat is above 120 beats. It's also higher, and the same thing, irregular heartbeats are the situation for such people. And how to control high blood pressure. That age is a factor. We can do nothing about it, but we can control our weight. So overweight is what we should avoid. Eating too much fatty food, we should avoid that. The familial history, once it's in the family, one should be extra careful. And the too much salt, especially as one grows older in age, avoid too much salt in your food, and probably you take things that like banana that contains more potassium. It will help eliminate the sodium salts. There is also the idea of grapes. When you eat grapes, it helps move the bad cholesterol away from the blood vessels, and takes it to the liver for processing. That the sedentary life is another one, which we are supposed to be doing exercise to improve our health. There is also eating fibers and vegetables, to avoid smoking too much, alcohol, water. Let us take more of water. And there is this essential hypertension, which affects 95% of the population who have hypertension. The cause is unknown, so we must also put that in mind. Then the same thing, the cholesterol, which has a closer relationship with hypertension, especially when you consider the cause. The cause is the same thing. Whatever causes hypertension will surely cause cholesterol hyperlipidemia. There is also, to test it, you can do it yourself, like the glucose meter,
There's cholesterol meter that one can use to test, but if you have to take it to the lab, you must observe 12 to 14 hours of fasting before the test. And in the lab, the serum is collected and the test is done. The normal value is between 200 milligram per deciliter. Borderline of such is 200 to 239 and 240. But what is of serious concern is the when you now take the fraction of that high cholesterol, your cholesterol, whether even it's normal, the one that is beneficial to the body is the high density lipoprotein, because that one is not deposited in the vessels. It does not cause plaque, nor does it cause atherosclerosis. The very low density and the low density lipoprotein are the one that they stay in that the vessels and clog it. A little clot can break out and cause a blockage, blood supply to the heart, especially the coronary artery that supplies the heart itself, and that will result in stroke or heart attack, death. So the same thing if it's a blockage to the brain. So the test is very important to differentiate, which that is what they call lipid profile test. That is, you want to know the various fractions. That is, like I said, since they are correlated in a way, what cause will cause hypertension will also cause cholesterol hyperlipidemia. So all you do is the same factor. Don't be too fat. Don't overweight yourself. Don't be overweight with too much fats. Reduce your saturated fats. Eliminate trans fats. Eat food rich in omega. Increase your soluble fiber, vegetables. Reduce your calories intake. Sedentary life. Avoid more exercise. Do more exercise. Cigarette smoking and alcohol too much would also increase the risk to have this hyperlipidemia. We can now talk about the treatment. The treatment is, of course, there are drugs for both lowering of cholesterol and also for hypertension treatment. And the modus operandi is almost the same. Just like we said, the ones that will lower the pulse rate, so that instead of having 120 something, that your pulse rate is higher, I mean the hypertension is there, then when the pulse rate is reduced, the heart is not forcing blood too much, then there will be probably reduction in the blood pressure. So it can also use the sodium excretion, increase the sodium excretion to control it. It could also use calcium. So, but these are in the purview of the clinician that will be treating the case. So let us leave that to the clinician that will be treating you.